15 years ago, Church Health Services was started because we wanted to help the people in our area communities who were on limited incomes and were uninsured. We knew some of our neighbors were suffering because their access to health care was limited. Many individuals and groups have come alongside us so that now we are able to offer several clinic sessions each month in the educational wing of this church. Our paid and volunteer healthcare staff help many people in great need.
I enjoy being the coordinator at Church Health Services because there are so many people that I can meet. It's been eye-opening to me, the needs that they have and the struggles that they have lived with day to day. It's very rewarding for me to be able to start the process where they can receive medical care that they may not have otherwise received.
The services here at Church Health Services, if I hadn't received them, I don't know what I would have done because I have no health insurance. I'm diabetic, and to be able to get health insurance, I would have had to pay anywhere from $400 to $500 a month out of pocket, which I don't make that kind of money. And without Church Health Services, I don't know what I would have done about my diabetes. I just probably wouldn't have gotten any care for it.
I found out about Church Health Services one day when it was a couple days after my 19th birthday, and I had received the letter in the mail from the Wisconsin State Medicaid program, which was initially my insurance for about 3 months, and it said that they would no longer cover me, and I reapplied and I was not eligible. And I was really sad, and my friend came in and she had told me about it.
And the hardest thing for me was to find out that I was one of those that really needed it. And I don't know what I would have done without the people I met. My doctors, my nurses, I mean, they're all terrific. And the people here were really, really wonderful because the lady that interviewed me stated that, you know, she could tell when I walked in that I was not misusing the system.
Right now I'm just working at Sunview Family Restaurant as a waitress. Don't have any benefits. I plan on going to school in January, however, I can't get health insurance until I'm going to school or I have a job with benefits.
It is so different from another city where they only have 2 nights where you can go in, and it's like first come, first serve. And here the idea that you can make an appointment, come in, actually talk to someone, I was overwhelmed by the whole idea.
Well, I came here not really knowing what to expect, and I got a chance to talk about things that I don't really tell people. I got some things off my chest, I got help, and somebody was actually willing to listen, and that made me feel better than anything. Rather than, having some sort of health assistance was also a benefit, but it was really nice to talk to somebody and have God also intertwined with my health, because I have a relationship with God, but I never really put it towards my health.
A few years later, Church Health Services started a second program. This program involved working with area congregations on their own health and healing ministries. These ministries are intended to serve the parishioners of that church, or sometimes as a special outreach to the community. Such ministries help the church better model the whole ministry of Christ, for the whole ministry of Christ involves teaching, preaching, and healing. There are many different types of health and healing ministries that work well in the context of any church, but the health ministry we chose to start with was that of parish nursing.
Parish nursing was started by Reverend Granger Westberg in 1984. In his work as a chaplain and in holistic health centers, he discovered that nurses made a special connection with patients on both a medical level and a spiritual level. A parish nurse works in a congregation as a member of the ministry team. Parish nurses can offer assistance in providing visitation in both the hospital or the community setting in the home. Parish nurses help families and their children understand health issues and can help them navigate the health system. Parish nurses also provide an opportunity for health education within the church setting. Either they offer programs themselves or facilitate programs that connect body, mind, and spirit, so parishioners can have a better understanding of wholeness and that relationship to their faith.
Well, I became a parish nurse because I returned to school to become an RN after my children had all gotten into school. And the last semester we had someone come and talk about parish nursing. And it sounded just like something I wanted to do right from the first time I heard her talk about what a parish nurse was.
They helped me coordinate and get together with Phoebe Weiss, who then came into the household and helped us understand what was going on with my husband at the time. Ron has now passed on, but she was here for us in all capacity.
What I like about it is that I can actually see an impact on what we do in the clinics and in my parish nursing on people's lives, even if it's a short time we're with them or an extensive time. I can really see we make a difference in people's lives.
When she would come in and how Ron used to light right up. And if anybody knows anything about ALS, one thing is the mood swings, the excessive mood swings. Phoebe would walk in this house and Ron would be instantly happy. And I don't believe that was because of what he had. I think it was because she brought that kind of spirit into this household.
When Dad was in the hospital, I remember her being there with me. The first time when he was first med-flighted down to Madison, she was there. I know she came down or she was there at the hospital. I know she couldn't come down with us, but she was there and she stayed with me and Jordan. My mom was helping Dad and stuff. I think that was one of the most memorable things for me anyway, when she was there.
There has been days where it was awful dark. And I will be honest with you, she really did. She would come into this household and it was like, it will be okay. We'll just pray about it. And there's a lot of times that got us through.
A lot of the people know what a parish nurse is. We have 2 right now that serve as our parish nurse, and they're well known by many in the congregation. They make it a point of being at retirees from time to time so that the retirees can go in and have blood pressure screenings or talk about their health, and that's been very important. The third area Church Health Services became engaged in was communicating a special health message to everyone in the community. Health and illness are complex topics, and we felt the community would benefit from a clear and simple, yet complete and truthful message on the basics of what makes a person sick and what makes them healthy. We called this message, My Building Blocks for Health. The first building block refers to the health of the whole person. It says, I am healthy or sick for many different reasons. My body, my thoughts and feelings, my relationships with family and others, and my relationship with God. The second building block refers to wellness. It says, being healthy is more than not being sick. The third building block refers to personal responsibility. It says, I have a responsibility for my health and the health of my neighbor. This message has been framed in poster form and can be seen in many area businesses and in the exam rooms of many physicians throughout our area communities.
That awareness is really the beginning of the ability to be able to change, and if you have an awareness of a problem, you can then address it. And I think a lot of folks, again, are focused on one area rather than looking at the whole picture. And rather than waiting for something to be broken, you need to have an awareness of all those aspects of our health, that we're not simply a body or a mind or a spirit or part of a community, but we're all those things in one. God made us as part of a community, and we need to address each of those things.
At this point in the development of our organization, we are most grateful for all that has been accomplished and for everyone who has helped. But what is really amazing is the thought that perhaps all of us have really been participating in the fulfillment of a biblical promise. In Isaiah 58, God expresses His displeasure with the empty and incomplete worship of His people. He says that true worship involves caring for the poor and the oppressed. He also says that when His people reach out to the poor and oppressed, He will heal and bless their whole community. When Church Health Services started its clinics and some of its special approaches to health care, this was a clear commitment to the poor. With the addition of parish nursing, now impacting thousands of parishioners in several area congregations, there was an advancement of that commitment. For our parish nurses who work in our clinics, and play a vital role in facilitating true whole-person care. With the addition of our health message, a health message that could very well transform the way everyone thinks about health and healing, this also was a commitment to the poor, for that message was first designed as a teaching tool for our clinic patients. This has been an amazing journey, but I have the sense that this is only the beginning of our experience with the blessings God has in store for each of us. Thank you.
Share your food with the hungry and give shelter to the homeless. Give clothes to those who need them and do not hide from relatives who need your help. Then your salvation will come like the dawn and your wounds will quickly heal. Feed the hungry and help those in trouble. Then your light will shine out from the darkness and the darkness around you will be as bright as noon. The Lord will guide you continually, giving you water when you are dry and restoring your strength. You will be like a well-watered garden, like an ever-flowing spring.